destiny.
I would like to welcome you all. It's good to have you all here. And today is the second day of our training. And I'll give like 2 minutes for people who didn't join to keep joining. And we are going to start right away. So today's session again will be with our prestigious Professor Albino Kalolo. He'll be taking us through today's session. And before he starts his session, he'll start with addressing a few questions that weren't addressed yesterday. So he's going to respond to a couple of questions that were asked for us to all be familiar, all be acquainted to the basics of implementation science that were addressed yesterday, and then we'll kickstart with today's session. So we'll give 2 minutes to allow other members to join. Then at exactly 4 minutes past 5, we'll start our session. Well, we've had 5 minutes to allow other members to join, so I think we'll start right away. Professor Kalolo, I would like to welcome you to today's session. Maybe a quick recap. So yesterday we started with Foundations of Implementation Science, which was also facilitated by Professor Kalolo. And we learned the core principles of implementation science and the distinction between implementation research and other types of researches. We also learned how to formulate a structured implementation science research questions, and we learned to understand the evidence-informed implementation. It was a really wonderful presentation, and there were lots of questions around it. So today's session will be more about implementation science frameworks. We're going to see how we can apply theoretical frameworks to analyze implementation barriers and facilitators. So before today's session, again, we'll start with a few questions that were addressed yesterday. I'd like to welcome Professor. The questions were shared with you yesterday. So if you're ready to share a couple of questions with their responses before we kickstart our today's session, you're very welcome, Professor.
Thank you, Naima. Yeah, so as you already said, I will start with some few questions which were raised yesterday, and then we proceed. Yeah, so the first question was from Bikla Legasa. Is there a recommended scope or sampling technique when conducting implementation research? How can we be sure whether the responses are rich enough to influence the policy or evidence-informed decision? And another from the same, where is the cutoff to stop or continue queries? Yeah, so I would like to respond as follows. Usually there is no like recommended sample size or sampling technique for implementation research, because yesterday we indicated that there are several research methodologies that we can use. So it will depend. For example, if you are using a purely qualitative method in your implementation research, it means you will follow the qualitative sampling techniques, where most of the time there are non-probability sampling approaches like purposive sampling, snowball sampling. Yeah, so you will use that particular sampling methodology for your qualitative research question. But also if you are using a quantitative approach for your implementation research question, yeah, so you will use the quantitative sampling techniques to actually respond to your to your research question. So it applies the same even for the mixed methods research. So that is my response for that part of the question. And then how can we be sure whether the responses are rich enough to influence the policy or evidence-informed decision? Yeah, so now based on your type of methodology that you are applying, for example, if it's a qualitative research, at the end of the day, you would like to use a methodology that is rigorous enough to actually less policy or influence practice. But also if it's for quantitative, yeah, so maybe if you have a bigger sample size or something like that for the quantitative approach. So this also depends on the methodology that you are using. And at the end of the day, you want to assure yourself that the methodology that I have used is rigorous enough to say that the findings we have got from this study can influence policy or practice or even evidence-informed decisions. Yeah, so it will depend on the methodology you are using, but you're also vetting your methodology, whether, I mean, you have corrected enough information to say, yes, this can influence policy or practice. And where is the cutoff point of to stop or continue with the queries? Yeah, if it's a qualitative approach, usually we base on the saturation. When you have collected data and then you don't get new information, then you can stop there. But for the quantitative, usually you have a minimum sample size, but you can continue because the more you increase your sample size, the more your study becomes stronger. It means you are reducing the various errors that could affect or biases that could affect your findings. Yeah, so that was, I mean, that is my response to the first question. And then the second question is from Seun Fabi. How effective is implementation research in behavioral intervention for the public? How effective is IR in behavioral interventions for the public? Yeah, I think even yesterday we provided some examples of already known evidences or already known solutions that have not been taken to the real practice. We mentioned, for example, coverage of some vaccines, could be COVID or hepatitis B or whatever, which actually depends on whether people will accept or will not accept that vaccine. And it depends on people's behavior. So at the end of the day, you will find that the public will take that intervention if you have addressed the individual barriers or individual behavioral like attitudes, knowledge, or motivation, things like that. Yeah, so you have a behavioral intervention, or I mentioned the COVID uptake, for example, but we could even mention some other like sexual behavior. Maybe people to use condom or not to use condom is a behavior, right? Yeah, so even, I mean, you could use implementation research to actually design strategies to implement such interventions. Yeah, so they are effective. Today we will discuss a bit about the various frameworks. Some of the frameworks are, I mean, behavioral frameworks, which can actually be used to, I mean, to help a behavioral intervention to be taken to practice. And the third question, are there any difference between translational and implementation research? Yeah, so in literature, you will find that there is what is called translation and what is called implementation research. Yeah, so in the continuum of research, especially the discovery research, from basic research to implementation research is a continuum. So the basic research, most of the time, is done in animals or in the lab or something like that. And translational research is when now those solutions, I mean, you are developing solutions from the basic research. For example, in a clinical trial where you have all those phases, so the translational part is where now you are actually testing at maybe in real patients. So it's like checking whether your drugs are, I mean, there is efficacy, there is effectiveness. So translational research is when now you are actually designing the solution from the basic research. So you started the basic and then you came to the clinical trials now. And then you get that solution. That is called translation. Or some people are saying from bench to bedside. So it means you are bringing close. You are discovering something that now helps the real patient. So that is translation. And implementation is now that evidence that you have discovered by doing some research or by doing some experiments at the bedside or among the patients. Now you want to take this to real world implementation. So implementation research is taking now this to the real world settings. It's not only at bedside or whatever. So it's going now, I mean, you are taking to where it will be implemented, it will interact with all challenges that the practice face. Yeah, so that is a difference between translational and implementation. So it's a continuum. You have discovered a solution, and this solution now you want to be taken to real world practice. And the fourth question is, IR is termed an emerging field. Why? Yeah, it's an emerging field because in the past, after doing a discovery research, people just thought that anyway, we will implement it. So they didn't think that implementation also is a science, or it's something that you need to study to maximize uptake. So it's like the term where people say, if you build, they will play. So you build maybe a football ground, and you say people will come and play. But people coming from their homes and whatever and coming to play, there are a lot of, determinants. Yeah, so implementation research is actually addressing those challenges that you have already a football ground, but people are not coming to play as you expected. So you are looking for the reasons. What is the reason? Maybe they don't like that football ground. That is one. Or there are barriers for entry to the football ground. Or they are just not comfortable to play football. They would like another game. Yeah, so this type of science in the past was somehow neglected. So that is why we are saying it's still an emerging field, because we are still discovering new frameworks and whatever. So it's still being studied thoroughly. That is why we say it's an emerging field. The last question, after identifying the implementation gap you want to address, for example, why essential drug list has not been adopted in our health institution by our physicians, which helps to address bland prescribing format as against acceptable generic prescription. You go back to draw at your implementation, you go back you go back to draw out your implementation strategies framework and it still doesn't work, how do you go about it? Planned prescribing causes a lot of problems for patients as they can't afford. Yeah, so in this situation where you have designed some strategies to address your question, and then those strategies are not working, so it means you will go back and rethink why the implementation strategies are not working. Maybe there was a problem with your strategies. Maybe they are not real strategies that can address that problem. For example, yesterday I explained that you are targeting adolescents, but you are coming with the strategies that are for adults and you expect them to work. It will not work. Yeah, so you should go back again and evaluate why your implementation strategies are not working. And usually you have to involve multiple stakeholders to reshape your strategies. We call it co-creation of the intervention. So you involve the beneficiaries, the physicians themselves, and you involve other stakeholders, behavioral stakeholders, or behavioral specialists who will work with you to actually design that intervention. Yeah, so we engaging the stakeholders in designing the implementation strategies could help you to actually get the desired results. Yeah, so thank you for these questions. I don't know, back to you, Naima, if there is any further follow-up on this.
Thank you very much, Professor. I think most of the questions that were left pending yesterday have been addressed, and we really thank you for that. I think we should now get on to today's session. The presentation is ready for you, Professor.
Thank you. Yeah, so today our focus will be on implementation science frameworks or the theories. And we have only two objectives. The first one is to understand the theories, models, and frameworks for implementation science methods or implementation science research. And later on, we will discuss how to link the theories or models with research questions. Yeah, so those are the two objectives. Yeah, so as an introduction, we have three categories of theories or frameworks for implementation science methods. The first group of theories are determinants theories. These are the theories that look at the determinants or the various factors, the barriers, the facilitators to implementation. Yeah, so we will discuss a bit about these theories that are actually mapping the determinants that could influence implementation. And then we have the process theories, because at the end of the day, we need to map the various processes that are happening as you are taking your evidence to practice. You are taking evidence to the real world settings. Yeah, so these are called the process theories, just understanding the various processes that have to be mapped. And then we have implementation theories, the actual implementation. What happens in implementation? What are you implementing at the end of the day? Which type of intervention are you implementing? So, I mean, these will actually help you to understand the implementation of your evidence-based intervention or strategies that are helping you to implement that intervention. Yeah, so we start with the determinant theories. Can you go to the next? Okay, yes. So the determinants frameworks, the what, this helps to systematically identify and prioritize barriers and facilitators across multiple levels. Barriers at the intervention level, because we said if the intervention is simple, it means it will be simple even to implement. But if intervention is very complex, so it will also be complex. But we have individuals. The individuals could be the implementers themselves, but also the beneficiaries of the intervention. And then we have the context, where we talk of inner setting and outer setting. And for these determinants frameworks, the very famous one is called the Consolidated Framework for Implementation Research. Maybe some of you have, used this framework in their research, or maybe planning, or they already know this framework. Yeah, so can we go to the next slide? Yeah, so this is the consolidated framework for implementation research, where you have individuals, and then you have these individuals could be the innovation recipients or the intervention recipients, the beneficiaries, or could be the implementers, or here we call innovation deliverers, but also others who are supporting that intervention. But we have opinion leaders in the communities, we have implementation facilitators, we have implementation leaders, implementation team members, high-level leaders, and they have their different characteristics. Yeah, so you need to understand first the individuals and their characteristics. But also you need to understand the inner setting. I mean, the context where you are implementing that intervention. So the various connections, the culture, tension for change, we call change management, mission alignment, relative priority. Is this intervention being prioritized by the people around there? So those are the inner settings. And then we have outer settings, partnerships, connection, financing, external pressure, policies, laws, local conditions, local attitudes, things like that. Yeah, so that is an outer setting. So you have to understand that for your implementation to actually work. And then you have your intervention or your innovation that you want to take into practice. Yeah, so you should think of where is this intervention coming from, the source of the intervention. If it's a medicine that you'll have to procure, and where is the evidence base to support that this innovation or intervention works, the relative advantage if you compare to other solutions that are already existing, because you want to take this into real practice. And probably in practice, there are some other intervention or some other solutions. So you have to think of the relative advantage. Is it advantageous if you compare to other solutions that are already existing? Adaptability, is it easily adaptable? Triability, can be tried and then you get, the results. Complexity, is it simple or complex? Design, what is the design of this intervention? Yeah, so for example, if it's injectable medication or it's pills or whatever, so I'm just giving that example. So you have to think of the design, but the cost, is it cheap or is it affordable? Because the individuals will be concerned about that, the cost of the intervention. And Another important aspect in the consolidated framework for implementation research is implementation process. Teamwork, assessing the needs, assessing the context, planning, something like that. But of course, this, as we said, that is a determinants framework. So the focus is on what can actually influence the uptake of this intervention. Yeah, so this is one of the very comprehensive frameworks that is actually assessing the determinants. So that is why we call a determinant framework. So there are other determinant frameworks that you can actually use to understand the facilitators and barriers at different levels. Yeah, can we go to the next? Yeah, so we used this framework to understand the barriers for contingent management at a methadone treatment clinic. Yeah, so the aim was to actually understand because methadone users, sometimes they do drop out from the clinic. And now, what are the issues that may be actually leading to, that we cannot implement the contingent approach or contingents to manage their expectations and whatever, so that at the end of the day, they can stay at the clinic. Yeah, so in this study, hello, can you hear me?
Yes, Professor, we can hear you.
Okay, someone indicated that they cannot hear me. Yeah, so we discovered that contingent management is not implemented at that clinic because of the trust between the methadone users and the providers or the healthcare workers. So there was no trust. But also awareness and knowledge that at that particular clinic, you can be motivated if you are attending, but also workload among the healthcare providers. So they were not actually thinking of implementing this approach because they are overworked. But client behaviors, sometimes clients behave in a way that they are not cooperative, and at the end of the day, it was difficult. Financial barriers, because clients have to travel to come to the methadone clinic, so sometimes they drop out. Yeah, so you can see our paper that we published in the next slide. This study was conducted at a tertiary hospital in Tanzania, just to understand the barriers to implement contingent management. Yeah, so we used the consolidated framework for implementation research to understand the inner settings, the outer settings, the individual behaviors, but how complex is the intervention itself? Is it a simple one or a complex one? Yeah, so if you want to find out more information, how we used this framework, you can read our paper. Yeah, so that is all about the determinants framework. We want to understand the determinants. But we have the process models or the process theories, the how things happen in the implementation continuum. So here we have two famous theories. One is called the EPIS model, exploration, preparation, implementation, and sustainment, which actually talks about the continuum. And then normalization process, that is another famous theory that I mean, is part of the process models. So can we go to the next slide? Yeah. So this is a EPIS model where you have exploration, you have preparation, you have implementation, you have sustenance, but you need to know the outer context to bridge the various factors that will actually affect the implementation, and then the inner context. Yeah, so this is a process model because you want to map everything. That if this cycle is well completed, at the end of the day, your innovation will be taken into actual practice. So you need to explore first. You have your intervention. How will it interact with the outer context? How will it interact with the inner context? Which factors can help you to implement well? Which factors can hinder implementation? But what are the actual innovation factors or the actual factors for your intervention? Just like what we discussed in the determinant framework. But here, you are mapping everything. You have to prepare, you have now to implement, and then you have to sustain. So it's like the entire process of taking the innovation or the intervention into real practice. So this is a EPIS model, which is a process model, mapping the entire process of taking it. But we have the normalization process model. So it means you are taking something and then you want that something to be normalized in the routine practice. It was not there, and in practice there are several interventions, there are several practices, there are several activities, and when you bring your innovation, yeah, so it has to align with what is happening there. So you want to normalize it. So normalization or making your intervention to be practiced as a routine practice. So you need first to find a clear implementation mechanisms or the strategies. So coherence building. Yeah, so you make sure that whatever you are implementing is actually very coherent and is actually accepted by the context where you are implementing. Cognitive participation, making sure that everyone who is involved in that intervention, they know it and they have taken it so that at the end of the day, it can stay for quite a long time. Corrective action. Yeah, so it's like not only a few individuals, because you have also to change the organization culture. So the entire organization should actually be together to make sure that this intervention is implemented. Reflexive monitoring. Yeah, so those are the implementation mechanisms that you have to apply for your intervention to actually stay in real practice. But implementation outcomes, I'm still on the same. Implementation outcomes. So you have to monitor the intervention performance time after time. You have to restructure the relationships among the implementers, the beneficiaries, and whatever. So in that way, your intervention will start. Normative restructuring, you do some restructuring, sustainment, or normalization. But you have also to think about the context, strategic intentions, adaptive execution, negotiation capacity, organizational framing. Yeah, so this is one of the very important process models that can normalize your intervention or your innovation that you have taken into practice. Can we go to the next one? Okay. And then we have implementation theories. The why. Why are we implementing this particular intervention? We are implementing this because we want to change something. Now, if we want to change something, that is where we use different behavioral and organizational theories that can help us change what we want to change. For example, you have noted that a certain intervention is, let's say maybe these days we are talking of non-communicable diseases. And one of the approaches is to make sure that people exercise. Now, exercising is not that easy. So you want to design an intervention that will promote physical exercises. And you know, there are several determinants, mainly behavioral determinants, that at the end of the day will influence someone to exercise or not. Yeah, so you develop an intervention based on existing theory. And because you are aiming at behavior change. Yeah, so there are various theories that have been used to influence behavior change, so that at the end you get what you desired. These are like the social cognitive theory, the organizational change theory, theories of human behavior like the COM-B model. Yeah, so these are the theories that can actually help you implement something that will lead to a change. So they are called implementation theories. Now, depending whether they are behavioral or organizational, because you want maybe a behavior change or you want organizational change. So you'll have to use these particular theories that will influence behavior change. So in a nutshell, these theories are like the ones that helps you to design the intervention itself or the intervention strategies because you want to change. Yeah, so can we show one example of the theory? The COM-B model, where you want to check whether capability, motivation, and opportunities can influence people's behavior. Yeah, so you will design an intervention based on this, and you will follow up its implementation and check whether there is any change. Yeah, so the next slide. Now, this is one of the papers that we published where we wanted to understand the determinants for using health research evidence in health planning in Tanzania. It was a cross-sectional study. But we used the COM-B model because we want to check whether this behavior is being actually practiced or is being implemented in real life settings. So we used the COM-B model to actually understand this. Okay. Yeah, so this is an example of the how we mapped everything. So we assessed the physical capability, the psychological capability, the reflective motivation, and automatic motivation, physical opportunity, social opportunity, as things that will actually influence the use of health research evidence. Okay. Yeah, so the last issue that I wanted to share with you is linking the theories, models with research questions. So first you need to map the frameworks based on your research question and context. Yeah, so if your interest is to understand the determinants, you will use the determinants theories to understand your research question. If your aim is to map the processes, then you will use the process models. But if your aim is to actually understand behavior change, for example, or organization change, you want change, yeah, so you will have to use the implementation theories. Yeah, so in a nutshell, these are some of the theories that I wanted to share with you, but I didn't exhaust everything because I grouped these theories and gave at least one example in among those theories. Yeah, so thank you for listening, and then I welcome you for the feedback.
Thank you much. Thank you very much, Professor, for the wonderful presentation. I think we now have ideas or snapshots of different frameworks that are used in implementation science, which is really great. So there were a couple of questions that were already sent in the chat box. So we had a starter of like 4 questions. So the first question is from Dr. Gusha Belako. And he asks, should we use the sphere model as a conceptual framework under the literature review? Or should we describe our study design as implementation research? Or should we state the specific research designs under the methods section?
Okay, thank you. Yeah, so as we already said that the consolidated framework for implementation research is a determinants theory, which helps you to map the various determinants. Yeah, so how to use it in your research? As we said, it helps you or it guides you to answer your research questions. Yeah, so that is something very critical, that it helps you to answer your research questions because you map those determinants and later on get the response to your research questions. Yeah, so when you are reviewing your literature, then you could review literature based on each of the constructs from the framework that you are using in your research question, because sometimes you don't use all the constructs. So you will select those constructs which you think are applicable. If you are using all the constructs, all the concepts, then in your literature review, you will have to navigate through one after another and see what is already known in, in existing literature. So you can use the CHFR in your literature. But the CHFR, CFIR, is helping you. So it's like a conceptual framework in a way, or it's guiding you to respond to your research questions. Now, whether you, in your method section, you can't say this is a design. We describe our study design as an implementation research. No, the study design, you have to explain the exact study design. Is it a mixed methods? But you say this research is implementation research, but you will use a certain study design. So that is important. Or should we state the specific research design under the method? Yes, you have to state the specific research design, but you say this is an implementation research. Yeah, so that was the first question. The second question, can we conclude that consolidation framework for implementation is appropriate to assess multi-level barriers and facilitators? Yes, because we said we want to understand from the individuals first. Who are the individuals? What are their interests? What are their motivation? And later on, we come to the inner settings, and then we go to the outer settings. So it assesses different levels from the individuals who will be the beneficiaries or implementers or evaluators or something like that. And then you go to the inner settings where you want to understand the context, and then the inner context, and then you go to the outer context. Yeah, so it actually assesses the determinants at different levels. Those determinants could be facilitators or barriers. Then what is the difference between implementation research logic model and conceptual framework? Okay, this is a very important question. When we talk of logical model, or sometimes it's called the theory of change, or it's called the theory of the intervention, it means we want to unpack what is in that intervention. So how does that intervention work? So it's like, how does it influence the outcomes? So what are the inputs in that intervention? What are the activities in that intervention? What are the expected outputs? And what are the outcomes? So that is called a logic model, or a theory of change, or a theory of intervention. It means you are unpacking the intervention itself to see what is in that intervention. Yeah, so for any implementation research, when you are testing or checking whether this intervention will work or not, you have to understand first the intervention itself. So the logic model, or the theory of intervention, or the theory of change, those are terminologies that are used to, to help you understand how the intervention works, the components, the critical components of the intervention. Now, when you say, when you talk of the conceptual framework, it's usually not always used in implementation research. Even for any other research, you could have like some logical flow, how the various concepts in your research are interacting. Yeah, so conceptual framework can be used in any type of research. It's not necessary in implementation research. But in implementation research, you are focusing on how the intervention brings change at the end of the day. I don't know whether it's clear. Can we use either of the two or both in implementation research? Yeah, so implementation research is possible sometimes to use both. You use the logic model or the theory of change if you want to understand your intervention, how it works. And then your conceptual framework will be another theory that is helping you to respond well to your research questions. Because one of your research questions could be that you want to understand well how the intervention works. Now that is a theory of change. But you have other research questions where you could use the conceptual framework to check how the dependent variables, and independent variables interact. Yeah, so it's possible to use both. But whenever you hear about logical model, or you hear about theory of change, or you hear about theory of intervention, it means you have unpacked your intervention to understand how it works. Okay, the fourth question, is there a situation in which we can apply 2 or 3 theories simultaneous? For example, use the CHFR and COM-B. It's possible. It's possible. So depending now on your research question, because you have one, you have a research project where you want to understand the determinants of implementation, but you want to understand the critical issues that will influence the actual implementation. So you could use different theories. So it's possible depending on your research questions. I think because time is not in favor to me, I could have shared with you some of the research that we applied multiple theories. Sometimes we have even 3 theories in the same. Yeah, maybe yesterday I shared with you how we assessed the adoption, implementation, fidelity, and sustainability of the redesigned community health fund in the Dodoma region in Tanzania, which was a new scheme for community-based insurance. In that paper, we used the diffusion of innovation theory because we understand that this is a new intervention, so it needs to diffuse in the community. Yeah, so we used the diffusion of innovation theory. But also we used the conceptual framework for implementation fidelity because we wanted to assess fidelity. So we used that one. Yeah, so you have 2 theories. But also, we wanted to, assess about acceptability. So there is a theoretical framework for acceptability. Yeah, so you can use multiple theories depending on how you have framed your research questions. So question 5, who are the influencers of intervention design between the beneficiaries and intervention implementers? Okay. Yeah, so usually you have 3 key players, not 2 key players as indicated here, that you have beneficiaries and intervention implementers. Usually you have the intervention designers, and then you have the implementers, and then you have the beneficiaries. So the success of the implementation of the intervention will depend on the implementers, their behaviors, their actions, but also the beneficiaries, their behaviors, their actions. Now, something else important which will have been designed by the designer is the implementation strategy, because the implementers are implementing according to the strategy that exists. Yeah, so it's like there is a bridge from the designer to the implementer, where the designer have to make sure that the implementer knows everything through capacity building, through everything. And then the implementer also have to make sure that the intervention is implemented. So the bridge there is implementation strategies. But the design of the intervention, the designers always have to seek opinion from the beneficiaries. That is what I call the co-creation, that you involve the beneficiaries, the implementers, the various stakeholders to co-create your intervention. If you do that, that intervention is likely to be adopted, is likely to be implemented, is likely to be sustained. Okay, so another question. Are beneficiaries considered and strategically involved in intervention design? I have explained this. In which category of the theories is the aim approach classified? The aim, I don't know because it's an abbreviation, but I think there is adoption, there is implementation, there is maintenance, which is sustainability. And then I think it could be in the process, theories, because it's, I mean, the way I see it, it could be in the process theories, but you could go and check more, because this is a specific theory, but I mentioned the 3 categories of theories. Do we conclude that implementation theories are appropriate when designing interventions targeted at behavioral or organizational change? Yeah, so that is what I said, because you want to, according to the current implementation research literature, implementation theories are the ones that at the end of the day are appropriate in designing interventions for behavioral or organization change. So are like the change management theories. Okay, number 8, how about the theoretical domains framework and the theoretical framework for acceptability? Okay, so the theoretical domain framework is actually the precursor or the theory that started before the COM-B model. Most of the constructs that are in the COM-B model are coming from the theoretical domains framework. Yeah, so and the COM-B model belongs to the implementation theories. The theoretical framework of acceptability is actually measuring acceptability, and it maps the various issues around acceptability. This one could be maybe among the determinant theories rather than maybe the process theories, because if you check the theoretical framework for acceptability, it maps the different issues that have to be considered when you are saying that there is acceptability. You map the workload of the people, you map their attitudes, you map a lot of things. Is it possible to have translational research while having implementation science? Yes, yeah. So I think I explained this. I repeat again. So translational research is a research that develops the solutions or develops the interventions that are later on taken to be implemented in real life settings. So the evidence comes from basic science to translational research. That is where this is a discovery research. It means taking something from the bench or from the lab or from somewhere to the bedside. But at that time, you are using a small population or maybe a small sample. But later on, implementation science takes it now to real practice. Then can we use more than one framework to address different research questions? I think I already explained this, that you could use several theoretical frameworks as you see fit for each of the research questions that you are having. Kindly simplify for me the difference between theoretical domain framework and consolidated framework for implementation research. Yeah, so the theoretical domain framework is a behavior change framework and belongs to the third group where we are calling this as the implementation research. In the theoretical domain framework, you have several constructs, and all these constructs were summarized to form the COM-B model. That the COM-B, you have the capability, you have the motivation, and they have the opportunity. So all those constructs or components of the theoretical domain framework were later on summarized to three constructs. And then the consolidated framework for implementation research, I think this was the first one that I explained that is determinants. You want to know the various determinants for implementation research. Thank you. Let me check if there are some more questions.
Thank you very much, Professor, for addressing these questions promptly and with so much details. I hope members that asked these questions have been satisfied with the answers. So we have like 23 minutes left in our time, and I'll now allow an engagement from participants. So those that have questions and would like to ask questions would now please raise your hand and we'll allow your mic and you'll be able to ask your question and it will be addressed by the professor. Are there any questions? I do not see any raised hands. Ismaila, please unmute your mic and yeah, feel free to ask your question.
Yeah, good afternoon. And thank you, Professor, for the wonderful presentation. So, what I want to ask is that, so how do we carry out implementation research in the real world? Do we first implement an effective intervention, then see how it works in the real world? Then, if it doesn't work as expected, then we do implementation research. Or implementation research can also be done maybe at the process of implementing an intervention. Thank you so much.
Thank you, Ismail, for a good question. Yeah, so as we are implementing, I mean, we have an intervention that we want to take it into real world settings. Yeah, so implementation research can be conducted at any time during the implementation, what we call process evaluation, and after the implementation, where we want to check the impact or we want to check the outcome. Yeah, so I mean, conducting research, implementation research, while we are implementing the intervention, can actually inform you where is the problem, and you can address that problem promptly. I could give you an example. When this community health fund program was being implemented, at the same time I was conducting implementation research to understand the reactions of the stakeholders to this intervention, but also to understand the implementers, whether they are implementing everything in fidelity, but also to understand the acceptability. And then I informed the intervention designers or the beneficiaries for, those who are who have a stake, the government, but also the development partners, I informed them that this and this and this is not working well. We need to adjust our implementation strategies. But I could have waited at the end. If you wait until the end, it means you are assessing something which at that particular time you can't even advise. Maybe if you are, you are assessing at the end, maybe you are assessing something related to sustainability. Was this intervention sustainable? Do you see some elements of sustainability at that particular time when you are assessing? And maybe you want to inform the scale up that I'm conducting this research now. My aim is to inform scale up, or my aim is to help this intervention to be normalized. You use the normalization theory. Yeah, so I don't know whether I responded well to your question. You are welcome for a reaction. Ismail?
Yes, yes, you have absolutely answered the question. And then I would also like to request that we would like to have maybe a link to all your publications on implementation research. I think reading that will also strengthen our knowledge in the field. Thank you, sir.
Okay, thank you. I will summarize and then share with Naima, and Naima will share with you all so that
All
you
right,
see
thank you,
the
sir.
various papers that we have published using the implementation theories.
Thank you, sir. Thank you.
Thank you very much, Professor. Thank you, Ismaila, for your question. We had one other question in the chat box, which asks, to what extent can program theory, including causal mechanisms, be integrated with implementation research?
Thank you. Thank you for this question. You remember we talked about the theory of change, the logic model, the theory of intervention. So some people call it program theory. Yeah, so these are different terminologies because as we said, this research is still emerging. So you might find several concepts, but in fact, they are the same. Yeah, so program theory is understanding how the program works or how the intervention works, the mechanisms until it produces the change that you want. Yeah, so it's part of the implementation research. And for any implementation research, you have to first understand the program theory. Even if there is no program theory, maybe this intervention, people just sat somewhere, discussed, and they said this will work. And then they started implementing without even having a clear program theory. For you as an implementation researcher, if you want to do any research or any evaluation, you need first to develop the program theory. For example, in some of my research papers, you'll find that I developed first the program theory or the theory of intervention or logic model or whatever, and then now I started understanding what is happening. Because you need to know what is taken in practice. Is it enough? Because sometimes you have a failure of the theory rather than a failure of the implementation. If you don't get any outcomes, maybe it was a wrong intervention. So you need first to know the program theory and then check whether the implementation was correct. That is where you will get the desired results. Thank you.
Thank you very much, Prof. We have very few questions today. I see there are no any pending questions, not in the chat box, and I guess there is no one with any pending questions. If there's anyone who wants to ask any question, please, now is the time. Otherwise, I guess we had a very interesting session today. I believe we are all still digesting most of the things we have learned, seeing how relevant what we've learned applies to our daily work, seeing how we can use implementation science in our day-to-day work. So if there may be any questions that come up when you're perhaps reviewing the materials or when you're just digesting the information or the details you learned today, please feel free to drop the questions in the WhatsApp group, and we're going to share the questions with Professor, and he probably will share the responses with us. Otherwise, Professor, I would really like to thank you so much for agreeing to share this very important knowledge with our people. I mean, it has been an incredible 2 days. We have learned so many things, and I believe most of us are now contemplating and trying to digest the information, the knowledge that we have gained, and seeing how we can apply that. So, Professor, we really thank you for your willingness to share this knowledge, and I believe people really enjoyed your sessions. Most of them have had a better understanding. So we look forward to the next trainings. Otherwise, for participants, it was really nice to have you today. Again, we emphasize on always trying to register and join the meeting at least 15 or 20 minutes earlier to avoid any last-minute challenges that include device challenges, any technical issues. So please try to join earlier to avoid these challenges in the last minute. Otherwise, all the materials will be available in the Google Drive that was shared through your emails. So all the materials will be posted there. That includes the video recordings as well as the presentations for your references. Might there be any other issues? Please address your challenges or any need of communication. Please use the WhatsApp group. It's very difficult to monitor the emails because as you can see, there are so many members. So responding to emails is very difficult for us to monitor. So please, if you have any concern, please address it through the WhatsApp group. Otherwise, we look forward to seeing you in our session tomorrow, where we're going to be discussing about implementation science methodology. So tomorrow we'll be having a new facilitator, Professor Cirilli. So please don't plan to miss. Please schedule the time, be ready to join when the time comes. Otherwise, I would like to thank you all and wish you a nice evening. Professor Kalolo, thank you so much for being with us in the past 2 days.
Thank you, Naima, for being a good facilitator as well. I mean, moderator as well. Thank you.
Thank you so much. We wish you a good ending or start of your day. Thank you very much.